Hi, my name is Paul So. I'm one of the kidney transplant surgeons at the Emory Transplant Center. The telemedicine program in Georgia is an initiative from the Georgia Partnership for Telehealth, and it's designed to help improve healthcare access and quality of healthcare for people in rural Georgia and underserved areas across the state. And basically this program allows for a patient to see a physician in the transplant clinic virtually from a remote location. I would be here in Atlanta at the Emory Transplant Center clinic when the patient will present at a patient presentation site somewhere in the state more convenient to his home, closer to home. And during this visit, I will be able to see the patient, examine the patient real time. I can use a stethoscope. I can basically accomplish what would happen if the patient actually presented here for an actual visit. Thus far, this program has been implemented for about 2 years. We've accomplished approximately 70 plus visits virtually. We've taken advantage of 9 sites throughout the state, and there's the potential for using 39 sites currently.
My name is David A. Dabble, and I live in Franklin, North Carolina. I had my kidney transplant October the 14th at Emory University, and since then I've been going to Emory for my checkups until I got a chance to do the telemedicine. And the main reason I chose it is a whole lot closer to home. I don't have to drive but about 20 miles, and saves going through all the traffic in downtown Atlanta or the outskirts of Atlanta. And it saves a lot of time and a lot of gas money, and it seems to be just as good. Because actually I do the same thing here as we do if we was going all the way down there. And the communication with Emory is good. Any problem I've had, I've been able to call there and talk to somebody there that can help me.
Josephina Taganahan, lead nurse in the outpatient transplant clinic. The transplant clinic nursing team pioneered and developed the policy and procedure for telemedicine. Our medical staff and clinic nurses identify patients who will benefit from telemedicine. It's a new concept, so we spend time explaining telemedicine to our patients. Once a patient is identified, there's a multidisciplinary process we follow. One is our front desk schedulers make the appointment with the nearest telemedicine site to the patient, coordinating Emory, the patient, and the site out in the community. The patient's nurse coordinator helps arrange for the patient to have lab work drawn locally and the results available before the visit date. On the day of the appointment, the outpatient transplant clinic nursing staff connects with the presentation site, rooms the patient, and makes sure the telemed equipment such as the otoscope, ophthalmoscope, and stethoscope are ready for the provider. Rooming the patient mirrors Emory Clinic standards, and all documentations are done here in our electronic charting system. At the end of the visit, we print and fax a reconciled medication list to the presentation site to give to the patient. Patients are satisfied and more compliant due to visit convenience, less stress, and saving in time and cost of travel. Telemedicine is the application of modern technology in medicine, the future of healthcare, which the outpatient transplant clinic embraces and serves as a magnet.
And it means me.